When someone is actively dying, how do you make the death rattle, that gurgling or rattling sound that you hear every time they breathe, how do you make that not so loud? My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. There are several different things that hospice might recommend when a person is experiencing the death rattle. Number one is they might recommend different medications. Some of the common medications that you'll probably hear or use are things like hyoscine or Levsin. You might hear atropine used. You might hear scopolamine patches being used. These medications are supposed to help dry up secretions. However, there's actually really not enough research and evidence to say that these medications actually work. However, in my personal experience, I do tend to recommend them to families when I'm working with families because in some cases I do think it makes it sound not so pronounced. One of the things that actually works sometimes better than any sort of medication is just repositioning the person. So for example, if they are straight on their back, maybe what you can do is actually turn them over to their side to allow those secretions to actually drain a little bit easier. What I would also recommend is having a towel next to their cheek or next to their jaw so that we can collect any sort of secretions that might come out of their mouth. If you feel called to support people at the end of life in any capacity, whether it's professional or just personal, our next certified end-of-life practitioner cohort is starting in April. You can learn more at our free training at deathcarecoach.com.